There's a lot to be said about weight, overweight, underweight sometimes, but the Center for Disease Control has cited that obesity is probably the #1 health factor that's now facing America and also worldwide. And so this month we're going to bring to you our Norton's Healthy Lifestyle Tip. I'm here coming to you from the Norton's Weight Management Center. And operating in that center would be the esteemed, I'm going to say esteemed because we're dealing with weight, Dr. Jeff Allen. Dr. Allen, thank you so much for being with us at Norton.
Thank you.
Healthy Lifestyle Tips for Urban Lifestyles.
Thanks for having me.
There's a lot that I don't know about weight issues and being overweight, but just explain to me and the audience about being overweight. You're here with the Bariatric Center, what that means, being overweight, who is a candidate, what criteria you have to meet, and whatever else we need to know.
Sure. Well, as you mentioned, being overweight is one of the major health problems of America and worldwide. I've been very fortunate to travel to places like Japan and China and places where you wouldn't think obesity would be a problem,
Yeah,
but it's a major problem there as well.
Wow.
Helping people lose weight is not a new idea, but it's a very difficult problem. It's one of the most difficult things. In fact, I think most people will agree that being overweight is a food addiction, and it's a very difficult addiction to kick. What we do here is one of the therapies that's available is surgery. There are a number of different surgeries that we can do to help people lose weight. It's certainly not a first choice. It's really a last choice, and it's, as you mentioned before, it's for people who meet a certain criteria, and it's a metric criteria. It's based on body mass index.
Okay.
And so a body mass index you can calculate by getting online. There's a number of body mass index calculators. The magic numbers are 35 and 40.
Okay.
If you have a body mass index over 40, you qualify for surgery.
Okay.
That correlates to roughly 100 pounds overweight. For someone, for instance, your size, I would say you're 5'5", 5'6".
5'3".
I
have heels on right now.
Okay, all right. So without the heels, if you're 5'3",
yes,
that would correlate to weighing about 230 pounds. So you'd be about 100 pounds overweight. And that would give you a BMI of approximately 40, 42, something like that. The other magic number is 35. If you have a body mass index over 35 and have a disease related to obesity, you would also qualify. And the diseases related to obesity, for example, would be high blood pressure, adult onset diabetes, sleep apnea, severe osteoarthritis.
Okay.
So if you have a body mass index between 35 and 40 with one of those disease processes, then you also qualify.
Oh, wow.
And so then there are a number of surgeries that are done worldwide. The ones that we do most commonly here at the at Norton are the gastric bypass and the gastric band.
Okay.
I've been doing these surgeries for 10 years. When I first started, gastric bypass was very common. However, now the band, because of its safety profile, has really increased in popularity and is now the more common operation, although we still do both of them.
Okay. And featuring the differences between the band and the bypass surgery. We're going to take a short pause, and when we come back, stay tuned so we can find out more vital information about controlling issues dealing with being overweight. We'll be right back.
Watch Urban Lifestyles with Max and Denise Maxwell, Sundays at 4 p.m. on the CW.
Okay, I'm back with Dr. Allen. Now, Dr. Allen, I know the criteria for patients to meet, you stated that. What does it mean when a patient comes to you and you decide which of two surgeries a patient may get? And also, would you explain to the viewing audience and myself what's involved in each and what does it mean for the patient?
Sure. So when somebody comes in for surgery, in my practice, we have basically two options, a gastric bypass or a gastric band. This is the band around the stomach, and this is what we call a little infuser port, and that's right under the skin. And this little area right here is where we can put a needle in. And it's just kind of like getting a flu shot here in the office. And this represents food coming down through, this is the esophagus, and this is down into the stomach. And you can see as when we hit it one time, the light comes on, and that's about how big the food is that's coming down through. And then we tighten it up by injecting saline here, and it gets smaller and smaller and smaller. And so as we tighten that down, that decreases the size of the pouch, and you can see food goes in there and it stops, and then it slowly goes down on through. And that slows down your eating, makes it so there's certain foods you're unable to eat, and by virtue of that, you eat less and you lose weight.
Is there any discomfort, or what is the recovery time, and what is it like for patients that have undergone the procedure?
Well, the procedure itself, I always tell them it's an operation of ones. It's a 1-hour operation, 1 day in the hospital, and 1 week off their normal activities. As far as doing an adjustment, we've already done 4 of them here this morning.
Wow.
It takes less than 5 minutes. It's kind of like getting a flu shot. Some people don't like needles, including me, but generally it's pain-free. We don't even use lidocaine, and we find that the lidocaine hurts more than the shot does.
Okay. Now, in regards to the other
yeah, so this
procedure.
this is actually not the other procedure. There are 2 brands of band that are available.
Okay.
This one's called the Realize band, and it's new. It comes from Ethicon, and this is the Lap band, and that comes from Allergan, and it's been around since 9 years. So we offer both of them. The other option, which is the gastric bypass, is not really a device that you put in. It's merely a rerouting of the intestine. We make a very small gastric pouch, and then we reconnect it in a different way so that the stomach is bypassed, so that the food you eat doesn't actually go in through most of the stomach.
Wow.
Yeah, it's a pretty complex operation, and that's the reason why it is a little more dangerous.
What are the results like in regards to success for the bands versus?
Well, we define success a couple different ways, one of which is how much weight that you lose. And at 5 years, the weight loss is equivalent. Although, in general, with a gastric bypass, there is more weight loss, and then the patients will regain a little bit of it.
In this case, it's almost going away overnight, so how do you get their mind, to catch up with all this?
Good question. Well, first of all, they're seen by a psychologist, nutritionist preoperatively, giving them proper diet. And I think postoperatively, I don't necessarily like for them to be on a diet. I just like for them to eat as much as they are, be comfortable, be satisfied, but have it be significantly less than before.
Okay. I think sometimes I've been in circles with women who say, oh, maybe I'll do this for cosmetic reasons, and clearly it's for medical, but how do you really weed that out?
Yeah, well, I think anytime you have a body mass index over 40, you certainly want the cosmetic result, but it's a health issue. It's not an easy way out, it's a health issue. The youngest we can do is age 18. There's no upper limit of age. Our average person's about 30 to 40, but we've operate on patients who are all the way up into their 70s.
Okay. Dr. Allen, this has been most insightful, and I hope that you all have gotten a tremendous amount of information about, first of all, we want to keep our weight down, but when it happens that we don't and we haven't, we have another avenue to gain some healthy success. So on that note, we're glad that you got some information, and stay tuned to more healthy urban lifestyle tips from Norton Healthcare.
Watch Urban Lifestyles with Max and Denise Maxwell, Sundays at 4 p.m. on the CW.